Chapter 5: Defining, Measuring, and Managing Stress. After this lesson, you should be able to describe the physiology of stress, identify sources that produce stress, define stress, explain factors that influence coping, discuss effective behavioral techniques for stress management. So, what does stressed out look like in our culture? Does it vary by age, region of the country, or other variables? I want you to think of a time when you were really stressed out. I want you to remember how you felt as we progress through this lecture. The beginning of your chapter actually has a nice check of your health risk, and it's a life event scale for students. That's on page 86. This should guide your thinking in a stressful life event. I want you to just think of one that was really stressful, that stressed you out. And as we progress through this chapter, I want you to reflect on that event and apply what you're learning to that time. So stress affects individuals both psychologically and physiologically. It is also the root of many chronic diseases. But first, let's talk about our bodies and its physical makeup as it relates to stress. Let's begin with the nervous system and how it relates to stress. The nervous system is made up of neurons, or nerve cells, that provide internal communication by the release of chemicals called neurotransmitters. The released neurotransmitters diffuse across the synaptic cleft, and this is the space between neurons. The billions of connections among neurons provide for complex actions. The nervous system is divided into the central nervous system and the peripheral nervous system. The central nervous system consists of the brain and the spinal cord, whereas all the other neurons in the body are in the peripheral division. The peripheral nervous system is also divided into two divisions: the somatic nervous system, which primarily serves the skin and the voluntary muscles in the body. The autonomic nervous system, or ANS, serves internal organs. The ANS is also divided into two parts: the sympathetic nervous system and the parasympathetic nervous system. These two divisions differ anatomically as well as functionally. The sympathetic division mobilizes the body resources in emergency, stressful, and emotional situations, and the parasympathetic division is active under normal, non-stressful situations. The neuroendocrine system consists of ductless glands, and the neuroendocrine system consists of endocrine glands that are controlled by and interact with the nervous system. These glands release hormones that travel through the blood and act on target organ. So let's talk about the pituitary gland and the adrenal gland. The pituitary gland is located in the brain and releases a number of hormones that affect target organs in many parts of the body. One pituitary hormone, the adrenocorticotropic hormone, and that's ACTH, acts on the adrenal glands. The adrenal glands are located at the top of the kidneys and contain the adrenal cortex, otherwise outer covering, and the adrenal medulla, the inner part, that produce different hormones. The adrenocortical response occurs when ACTH from the pituitary stimulates the adrenal cortex to secrete glucocorticoids, the most important of which is cortisol. The adrenomedullary response occurs when the sympathetic nervous system activates the adrenal medulla and secretes epinephrine and norepinephrine. These hormones are used in physiological measures of stress. In other words, they directly assess aspects of the body's physical stress response. Physical measures include increased secretion of cortisol and epinephrine, in addition to measures of blood pressure, heart rate, galvanic skin response, and respiration rate. A disadvantage of these indexes is that the equipment and the setting themselves may produce stress. Also, it's very expensive. So overall, let's talk about the physiology of the stress response. The stress reaction mobilizes body resources to react in emotional, stressful, and emergency situations. One route occurs through direct activation of the sympathetic nervous system, which is called the adrenomedullary response. The other route is through the hypothalamic pituitary adrenal axis and involves all these structures. The response of the hypothalamus prompts the pituitary to stimulate the adrenal cortex to produce glucocorticoids, including cortisol. Maintaining an appropriate level of activation under changing circumstances is called allostasis. Prolonged activation of the sympathetic nervous system creates an allostatic load, which can overcome the body's ability to adapt. Given what you know about the body's physiological response to stress, I want you to think back upon that time when you were really stressed out. What aspect of being stressed out was a stimulus, a response, or an interaction? How did your body physically react? Did you feel tense? Did you feel like blood was rushing throughout you? An understanding of the physiology of stress does not completely clarify the meaning of stress. To get a better understanding of how stress is defined, we must review two theories. One of those theories is the general adaptation syndrome, which is defined stress as a non-specific response to a variety of environmental stressor. Selye coined the term general adaptation syndrome, or GAS, to refer to the body's generalized attempt to defend itself against a stressor. So think about those physiological responses. The GAS has three stages: alarm, reaction, resistant stage, and exhaustion stage. The potential for trauma or illness exists at all three stages. GAS really helps to explain how stress relates to physical illness. For example, continued stress will cause prolonged resistance, which may be related to ulcers, hypertension, asthma, and possibly resistant to the immune system, which we will discuss in your next chapter. Selye concentrated on the physiological aspects of stress by downplaying the psychological ones and ignoring the perceptual and interpretive process that can moderate the human experience of stress. Whereas Richard Lazarus saw a person's perception of an event as more important than the event itself. Lazarus held that people are affected by stress only if they perceive a threat. They are in a vulnerable state and believe they lack the ability to cope successfully with those events. Lazarus and Folkman recognize that people make three kinds of appraisals: a primary appraisal, a secondary appraisal, and a reappraisal. Primary appraisal is one's initial judgment of an event, which may be seen as 1. Potentially harmful, 2. Threatening or damaging to self-esteem, or 3. Personally challenging. Secondary appraisal is one's perceived ability to control or cope with harm, threat, or challenge. Reappraisal of an event occurs as an ongoing process to reevaluate a changing situation. Having a number of options available that you feel you can use to reduce harm or threat will make the event less stressful. So Lazarus discussed coping. Well, coping is defined as constantly changing cognitive and behavioral efforts to manage specific internal and or external demands that are appraised as taxing or exceeding one's resources. Overall, Lazarus places a strong emphasis on a person's perception of stressful events. Accordingly, measures of perceptions wouldn't include physical measures of stress that we discussed before, such as measures of blood pressure, heart rate. Self-reports, which is a second method of measuring stress, would be more appropriate given Lazarus' theory. Self-reports measure either life events or daily hassles that a person experiences. However, a challenge with using self-reports is that people tend to overestimate their stressful experience. So, as you gather from Lazarus' view of stress, and also from the understanding of the body's physiological response to stress, well, there are many sources for stress, and there are three main ones: cataclysmic events, changes in a person's life history, or hassles from everyday life. We can all talk about commuting in Southern California. That's a everyday hassle. Cataclysmic events is defined as sudden, unique, and powerful single life events requiring major adaptive responses from population groups sharing the experience. These events affect large numbers of people and may be unintentional events such as a natural disaster, or even intentional events such as terrorist attack. People who experience cataclysmic events may develop symptoms of depression and post-traumatic stress disorder. Several factors moderated or exacerbated these symptoms, such as their feelings of support from others, discrimination, and their proximity to the destruction. Well, this month marks the 18th anniversary of 9/11, which is a really good example of a cataclysmic event. Many people still suffer from depression, PTSD, and chronic disease as a result of that tragic day, but others have huge social support networks to help them cope. So the other source of stress are life events. So while cataclysmic events occur to some people, but everyone experiences life events that require change. These events affect individuals rather than groups and tend to take place over time rather than suddenly. Death of a spouse or a parent and job loss are examples of such life events. But so is crime victimization, which is a life event that produces stress. The third source of stress: daily hassles. Daily hassles are events that occur as part of everyday life. The stress brought on by daily hassles can originate from both the physical and the psychological environment. Many people associate environmental sources of stress, such as noise, pollution, crowding, fear of crime, and personal alienation with urban living. These factors combine to produce what Eric Gregg termed urban press. Noise is a type of pollution because it can be noxious, unwanted stimulus that intrudes into a person's environment. Population density is a physical condition in which a large population occupies a limited space. Crowding, however, is a psychological condition that arises from a person's perception of high density environment. The distinction between density and crowding means that people's personal perceptions, such as a feeling of control, are critical in definition of crowding. The environment of poverty includes violence or the threat of violence, discrimination, and the fear of crime. Children who grow up in an environment of poverty experience greater chronic stress and an allostatic load, which may contribute to health problems later on in life. These individuals are often subject to hassles from the psychosocial environment as well as the physical environment. Discrimination is a common experience for African Americans in the United States, creating daily hassles in the community and the workplace. Other ethnic groups, such as women and members of the LGBT community, also experience stress due to discrimination, which may affect their cardiovascular health. Other situations that produce stress at the workplace include jobs with high demand and low control, such as a waiter or waitress, construction workers, and middle-level managers. Workplace stress may also affect personal relationships and produce conflict between work and family. So I have mentioned coping with stress a few times throughout this lecture. Well, the term coping is usually applied to strategies that people use to manage the distressing problems and emotions in their lives. Folkman and Lazarus suggested a number of personal resources that could help people manage the demands of a stressful situation, including good health, optimistic beliefs, socioeconomics resources, social skills, and social support. Although research supports the importance of these resources, the most important personal resources for coping with stress are social support and sense of personal control and optimistic beliefs. So we discussed social support actually this past week. So as you recall, social support refers to a variety of material and emotional supports that a person receives from others. The related concepts of social contracts and social networks are sometimes used interchangeably. Both refer to the number and types of people with whom one associates. Social isolation refers to the absence of specific, meaningful interpersonal relations. In your textbook, they discussed the Alameda County study, which established that a strong link between social support and longevity. So social support may help people in improving their health by providing encouragement to adopt healthy habits or seek medical care. It may also help people gain confidence in their ability to handle stressful situations by altering the physiological responses to stress or by buffering against stress. A feeling of personal control may also help people cope with stress, either by having an internal locus of control or an external locus of control. A study of nursing home residents by Ellen Langer and Judith Rodin suggested that when people are allowed to assume even small amounts of personal control and responsibility, they live longer and healthier lives. Optimists are people who expect good things to happen to them, whereas pessimists are people who generally expect bad things. Optimists experience less emotional distress than pessimists. When people feel confident that good things are likely to happen, they are more likely to persist in pursuing important goals in the face of stress and setbacks. So be optimistic. So what about coping strategies? Coping strategies may be classified in many ways, but Folkman and Lazarus' conceptualization of coping strategies as a problem focus or emotion focus is the most influential. Problem-focused coping is aimed at changing the source of the stress, whereas emotion-focused coping is oriented towards managing the emotions that accompany the perception of stress. Both types of strategies can be effective, but they may not be equally effective in managing the stressful situation. The type of stressor and whether the impact was on psychological or physical health explain the relationships between coping strategies and health outcomes. In general, problem-focused coping contributed to good health, whereas emotion-focused coping strategies contributed to poorer health. So let's now talk about behavioral interventions for managing stress. Some people classify behavioral techniques as part of a mind-body medicine and thus part of alternative medicine. Psychologists have developed techniques to teach people how to manage stress. 3 of them are relaxation training, cognitive behavior therapy, and emotional disclosure. So modern uses of relaxation training can be traced to Edmund Jacobson, who developed a type of relaxation called the progressive muscle relaxation during the 1930s. With this procedure, patients first receive the explanation that their present tension is mostly a physical state resulting from tense muscles. While reclining in a comfortable chair, often with the eyes closed and no distracting lights or sounds, patients first breathe deeply and exhale slowly. Autogenetics training is another approach to relaxation, and it consists of a series of exercises designed to reduce muscle tension, change the way people think, and the content of people's thoughts. And they both are very effective in tested situations. So, cognitive behavioral therapy, CBT, it's very popular for clinicians and counselors alike. CBT is the simplest and easiest to use of all psychological interventions. And it's very useful in managing stress. It aims to develop beliefs, attitudes, thoughts, and skills to make positive changes in behavior. CBT assumes that thoughts and feelings are the basis of behavior. So CBT begins with changing attitudes. CBT focuses on modifying environment and contingencies and building skills to change observable behavior. Research on the efficacy of CBT indicates that it is effective for both prevention and management of stress and stress-related disorders. For example, CBT is effective with a wide variety of clients and is one of the most effective techniques for reducing stress among college students. The last one is emotional disclosure. Research by James Pennebaker and colleagues shows that emotional self-disclosure improves both psychological and physical health. Emotional disclosure is a therapeutic technique in which people express their strong emotions by talking or writing about negative events that precipitated those emotions. Pennebaker took the notion of catharsis beyond Breuer and Freud by demonstrating the benefits of talking or writing about traumatic life events. The general pattern of Pennebaker's research is to ask people to write or talk about traumatic events for 15 to 20 minutes, 3 or 4 times a week. Emotional disclosure should be distinguished from emotional expression, which refers to emotional outburst or emotional venting, such as crying, laughing, yelling, or throwing objects. Emotional disclosure, in contrast, involves the transfer of emotions into language and thus requires a measure of self reflection. Emotional disclosure can be effective in reducing feelings of distress and improving health. When people are urged to find a less negative interpretation for their trauma or to make a plan to improve their stress, they benefit additionally from the process of emotional disclosure. So, a good example of emotional disclosure is journaling about your experience. You had a negative experience. Write about it. Write about your feelings. Write about your thoughts about it. And it's a healthy way of releasing your emotions. So that wraps up Chapter 5's lesson. Please read the textbook material. It provides additional details. And you will have test questions that come straight from your textbook. If you have any questions or feedback, please let me know. You can email me directly, or if you want to remain anonymous, you can use the tiny URL link. Stay healthy, everyone.